6 items sat on a respectable Victorian medicine cabinet. Every single one of them was actively poisoning the person using it. None of them were illegal. None of them were sold out of a covered wagon by some con man with a fake mustache. They were on pharmacy shelves and newspaper ads, recommended by real physicians with real medical degrees. Tonight we are ranking 6 of the worst offenders from bad to genuinely horrifying, and the one at the top ends with a man's jaw coming apart in pieces. Here is what nobody tells you about medicine before 1906 in the United States. There was no federal law requiring a company to list what was actually inside a bottle. You could sell something containing arsenic, morphine, or radium and call it a tonic, a wafer, or a soothing syrup. As long as you were not lying about the brand name, you were fine. That is not a loophole. That is the entire system. So let us start at the bottom of the list. Because even the mildest entry here was quietly reshaping people's nervous systems one dose at a time. Number 6 is Blue Mass, a mercury-based pill that doctors handed out for practically everything. Melancholy, toothaches, worms, tuberculosis, a bad mood. Blue Mass was the 18th and 19th century answer to most of it. Each pill delivered a dose of elemental mercury far higher than anything considered safe today. Historians and toxicologists who studied Abraham Lincoln's documented use of blue mass pills for what he called his hypochondriasis found something startling. His dosage, if the math holds, may have pushed him thousands of times past a modern safe mercury threshold. Lincoln reportedly stopped taking them shortly before his presidency began. After noticing it made him unusually irritable, which happens to be a textbook symptom of mercury toxicity. Doc tilts his head a couple of degrees at this one, entirely unimpressed. Like he has heard this excuse before. Mercury poisoning builds slowly, attacking the nervous system, the kidneys, and the gums. And because the symptoms crept in over months, almost nobody connected the medicine to the decline. That is the pattern you are going to see over and over on this list. A slow poison mistaken for the disease it was supposed to be treating. Number 5 moves from adults to children, which is where this starts getting uncomfortable. Cocaine toothache drops, sold by the Lloyd Manufacturing Company out of Albany, New York. Starting in 1885, were marketed with an advertisement showing 2 happy children, and the promise of an instantaneous cure. 15 cents got you a bottle of liquid cocaine, meant to be rubbed directly onto a child's aching gums or dissolved teeth. It worked in the sense that cocaine is an extremely effective local anesthetic, which is exactly the problem. A parent watching their toddler go from screaming to calm in under a minute had no reason to question what just happened. Doc's eye widens slightly here, about as much emotion as a stoic duck allows himself, and he taps the cracked lens of his monocle like he is double-checking he read that correctly. There was no dosage guidance on the label. Because nobody at the company was tracking a safe pediatric dose for a Schedule II narcotic. Because in 1885, that classification did not exist yet. Cocaine was not federally restricted in the United States until the Harrison Narcotics Tax Act of 1914, nearly 3 decades after parents were rubbing it into their children's mouths as a bedtime routine. Number 4 is where the target audience shifts again, this time to women being sold poison as a beauty routine. Arsenic complexion wafers were marketed in Victorian and Edwardian magazines, under names like Dr. Campbell's Safe Arsenic Complexion Wafers, promising clear, pale, luminous skin with regular use. The pitch made sense within the beauty standards of the era, since a fashionably pale complexion signaled that a woman did not have to labor outdoors. And arsenic really does produce a temporary flush and pallor by damaging capillaries near the skin's surface. The word safe was printed directly on the label, which tells you everything about how casually arsenic was treated as a consumer ingredient at the time. Doc turns his head fully away for a beat here, refusing to even look at the wafer tin, which is about as close to a physical objection as he ever gets. Chronic low-dose arsenic exposure causes skin lesions, liver damage, and over years, measurably increases the risk of several cancers, none of which shows up on day 1, which is exactly why women kept eating them for months at a time. Fowler's solution, sitting at number 2 on tonight's list, deserves its own conversation. Because unlike the wafers, this one was not a fringe beauty product. It was a mainstream, physician-prescribed general tonic containing 1% potassium arsenite, developed by Thomas Fowler in 1786, and still being prescribed by doctors well into the 20th century. Fowler's solution was given for anemia, for asthma, for skin conditions, for what doctors vaguely called weakness, and it stayed in medical use for over a century longer than the mercury pills at number 6. That is not a fringe quack remedy. That is a drug with a decades-long run in mainstream Western medicine, dispensed by licensed physicians who genuinely believe they were helping. Doc's monocle nearly slips off here, and he catches it without breaking his stare, because even he seems to register that this one had actual institutional backing behind it. Later epidemiological studies tracking patients who had taken long-term Fowler's solution found significantly elevated rates of skin and internal cancers. Decades after treatment, cancers that sometimes did not appear until 20 or 30 years after the prescription ended. Think about what that means for accountability. A doctor in 1890 prescribing Fowler's solution to a patient with a skin complaint had no way of connecting it to a later diagnosis, a cancer diagnosis in 1920 back to a tonic bottle from 30 years earlier, and neither did the patient. Number 3 is the one that turns this from unsettling into genuinely enraging, because it involves infants who never had a say in any of it. Mrs. Winslow's soothing syrup launched in 1849. Formulated by Jeremiah Curtis and marketed under the name of Charlotte Winslow, a nurse. And it became one of the most widely purchased patent medicines in American and British history. The syrup was sold specifically for teething babies, promising to calm a crying infant almost immediately, and it worked, because the active ingredient was morphine sulfate. A single teaspoon dose for an infant of that era could reasonably be described as a significant opioid dose relative to body weight. Dispensed by parents with no medical training, based purely on a label that never mentioned the word morphine. Doc goes completely still on this one, no head tilt, no reaction, just stopped, and he holds that stillness for longer than any other entry on this list. Infant deaths tied to opiate-based soothing syrups were documented well enough that by 1911, the American Medical Association's Nostrums and Quackery report singled the product out by name, effectively branding it a baby killer in print. The company kept selling it in some markets for years after that report, because there still was not a federal mechanism forcing them to reformulate or withdraw it, only public shame and shrinking sales. Which brings us to number 1, the worst thing on this entire list, and the one that finally forced a government agency to act. Radithor was a radium-infused water tonic sold starting in the early 1920s by William J. A. Bailey through his company, Bailey Radium Laboratories. Marketed under the slogan Perpetual Sunshine, each bottle contained genuine radium-226 and radium-228, dissolved directly into distilled water, sold with the promise that it would restore vitality, cure impotence, and generally recharge a tired body with the power of radioactivity. This was not a fringe backstreet product either. Radium was culturally associated with cutting-edge science in the wake of Marie Curie's discoveries, and companies raced to slap the word radium onto everything from toothpaste to cosmetics to drinking water. Eben Byers, a wealthy Pittsburgh industrialist, former United States amateur golf champion, and prominent socialite, started drinking Radithor around 1927 on his physician's recommendation, initially for arm pain after a fall. He liked how it made him feel, so he kept going, reportedly consuming somewhere around 1,400 bottles over roughly 3 years. Doc does not move at all through this entire segment. No tilt, no turn, just a fixed, motionless stare, because there is nothing dry or funny left to react with by this point. By 1930, Byers's jaw had begun to deteriorate visibly. His teeth were falling out, and doctors discovered that the radium had lodged permanently in his bone tissue, where it continued irradiating him from the inside with no way to remove it. Surgeons eventually removed most of his jaw trying to slow the damage, and Byers died on March 31st, 1932, his body so radioactive that he was buried in a lead-lined coffin. The Wall Street Journal covered his death with a headline that has outlived nearly everything else about this story, stating plainly that the radium water worked fine until his jaw came off. Here's the part that actually matters, the part every entry on this list has been building toward. The Federal Trade Commission had already opened an investigation into Bailey Radium Laboratories in 1931. After reports of buyers' declining health reached regulators, and it issued a cease and desist order against the company. One of the first times a federal agency had moved directly against a radioactive consumer product. But notice what the earlier Pure Food and Drug Act of 1906 could not do here. That law required accurate labeling, not actual proof of safety. So a company could legally sell a bottle of genuine radioactive water as long as it did not lie about the ingredients. Radithor's real crime under existing law was not poisoning people. It was slightly overstating its radium content on the label, which is the detail that actually gave the FTC its opening. The gap that let Radithor exist legally for years stayed wide open until 1938, after a second disaster involving a drug called elixir sulfanilamide killed over 100 people, many of them children, when its solvent turned out to be a close chemical relative of antifreeze. That second tragedy is what finally pushed Congress to pass the Federal Food, Drug, and Cosmetic Act of 1938, which for the first time required a company to prove a product was safe before it ever reached a shelf. Not just accurately labeled. Eben Byers did not cause that law by himself. But his death, and the public horror around it, became part of the pressure that made the old system impossible to defend. Every product on this list existed because proving safety was never actually required, only telling the truth about what was inside the bottle. And those turned out to be very different standards. The 1938 law is the reason a modern company cannot legally sell you radioactive water, no matter how honest the label is. Because honesty stopped being enough. If you want to see exactly how the medicine cabinet cleaned itself up after this, tell me in the comments. Which one of these 6 horrified you most, and I will build the next ranking around it. Keep ingesting education.